in Dudley. Earlier, I spoke to consultant neurologist Dr. David Nicholl, who works in Birmingham and is a member of the Doctors Association Committee, for his take on the current situation.
I think what we're finding worrying in Birmingham is just watching what's happening in London, because the number of hospitalisations are going up. Yeah, that hasn't happened in the Midlands yet, and I guess just a lot of us are anxious of what's going to happen next, and so in a way it's sort of getting ready for that, basically, which is, you know, quite anxiety provoking, but and also because people are fatigued.
So clearly the next month is critical.
Absolutely, and I mean, in fact, one of the biggest worries I think is staff sickness as much as anything, and the impacts that can have, not just in secondary care but also primary care as well.
Yeah. We've been hearing today that Russell's Hall Hospital have a 9% absentee rate already due to COVID.
And you know, that's a really big worry at this time of year. You know, Christmas, people are tired. You know, some people haven't had a break in a couple of years, basically, and you know, it really stretches the system to breaking point.
As you understand it, how many of the hospital cases at the moment are unvaccinated?
The majority, and certainly of those who are most severely ill, as in need up an ITU or ventilated, almost all of them will be unvaccinated. And this is just so sad because it is avoidable, and you know, it is a particular worry, particularly in some pockets of Birmingham, where you know, sometimes 50% of the adult population have yet to have one vaccine, let alone talking about boosters.
Surely you can understand people having some misgivings.
There's been a lot of vaccine hesitance, but what we now know is that there is really clear evidence that vaccines are stopping people from getting very seriously ill, but there is a lot of vaccine hesitancy, and I myself, not the BBC, I would make to add, is actually just some of the misinformation, even amongst broadcasters, is a real concern.
Should there be more restrictions?
I think I think is where we need to be reliant on the public health side of things. That and I think I was in Corporation Street today, and it's clear people are voting with their feet, and that creates its own problems in terms of hospitality and things like that. And was obviously we actually need to act like Queen. She's changed her plans to quieten down. And actually, you can think about PPE. I mean, I've got a surgical mask here, but I'd say if you're on public transport, actually using an FP2 mask is probably better, actually, in terms of because we know that Omicron is just much more transmissible. In fact, the Doctors Association have written to the Health Protection Agency to try and get better grade of PPE in healthcare settings. But there's, as I said, there's things that people can do in the community and wear better grade masks.
Just finally, what would your message be to those who are hesitant about having the vaccine?
It's really important to listen to trusted sources of information, and speak to a qualified healthcare professional. Don't rely on Bob on Facebook for your information, basically, unless of course Bob is an immunologist.
Dr. David Nicholl, thank you.
Thanks a lot.
Now, Boxing Day, as you know, is traditionally a big day